Hello, class. Now we are continuing with chapter 3. So we're going to start with the reporting of birth, deaths, and diseases. Again, dealing with epidemiology, these are very, very important data that epidemiologists, the respective professionals within the public health profession need some of this information. Also, legislators, communities, because when they make plans as to what area should receive some support in trying to address some of these issues, they should be able to have functioning data to help them to address some of those things. So the report of birth rate or deaths and diseases is very, very important. Because when the federal government or the state department or the local community, the local and department, when they have that data, it helps them to know how to prioritize their resources as well as what area needs certain help in certain areas. Because again, the intent of all of this, as we all know, the key factors of public health is to assess the present conditions of various communities as it pertains to health, and to help develop certain policies, make certain suggestions to the legislators, to the politicians, and also to some of these foundations who are ready or committed to addressing public health. And also assurance, give people the assurance that the information they are getting, if properly used, can enhance the health of that respective community. So reporting birth rate, death rate, and diseases. Now, physicians, doctors, usually in most cases, they write and develop, I think there's a certificate that is written to show that somebody is dead. And most of the time is, and in fact, it's signed by physicians, doctors. And in clinics, most of the time, clinics are places wherein also diseases can be detected, and it also helps with, because depending on the situation, clinics also helps with and deals with some maternal issues, childbirth and other place, and childbirth, and also help with reporting death, and also help with the investigation of diseases. And hospitals. See, all of these three, the physicians, the clinic, and the hospitals, are required to report birth. They are required to report death within their facilities, and also are required to report noticeable diseases, so that once it's known that certain disease is in a particular environment or community or locality, Depending on the nature of the disease, the information is shared from the local to the state to CDC. And CDC, the Centers of Disease Control and Prevention, will determine or will come and investigate and make necessary recommendations. Okay, notifiable diseases. Now, some diseases need, people need to know infectious diseases for which health officers request or require reporting can become epidemic. So that's why it's very, very important, especially those infectious diseases, communicable diseases. It might appear with one person or two, but as they go back home and get into the community, before you know it, what was just one person now becomes epidemic. And so therefore, the respective public health personnel should know about it so that they can investigate, find ways, what is the disease, what are possible ways to prevent it. Now that is known, okay, that is a communicable disease. How is it communicated? Is it through bodily fluid? Is it through airborne? Or is it through chemicals? Is it from food? Is it from the water that people drink? Is it because once it is known, the better. Same thing. The most arguments that people are now having is the notifiable diseases. See, there is the kind of an argument within the different countries and as to how effective or how prompt China was in notifying people about the coronavirus. Some people think it was too late. Others believe, well, they did the right thing. But as with any disease, the sooner people know, the professional, the health professional, the sooner they know about it, the better the chances for that disease to be put under control or to be stopped from spreading. So it's very, very important for people to do this reporting. It's very, very important. Birth rate need to report so that it contributes to the population, so that people know population growth, how many births are occurring in a particular environment, in a particular community. Because again, when plans are being made, these are all. How many schools are we going to build? How many, for political reasons? There are a lot of things that that are addressed by knowing some of this data. The death rate, how many people are dying? Dying from what? Is it because of some of these diseases? And what are those diseases? And how can they be controlled or how can they be addressed? Very, very important. Then reported to CDC via National Electronic Telecommunication Systems. So some of this information are reported to CDC. In most cases, depending on the nature, from the local environment, from the local community, it goes to the state health department. The state health department collects all the information within the state and send it to CDC through National Electronic Telecommunication System. Various challenges to maintain accurate data. Well, as is with collecting data, most of the time, certain people are good at reporting. Some people are also not that good. Especially most of those, when it comes to certain diseases, some diseases are promptly reported to CDC if those facilities that people used people use are facilities that are funded by the federal government or the state government or the local government, because they need those data. Most of the time, it becomes a challenge for some private clinics, private hospitals. At times, they report, yeah, there are certain diseases that must be reported immediately, regardless of whatever. But there are some diseases that they might just not be too prompt in reporting some of those diseases. You see, because that's why you see certain things that it's kind of lopsided, especially when you're dealing with social issues. Most of the time, there is a kind of a high rate of data, a high rate of reporting when it comes to issues that pertains minority or people with low socioeconomic status, because they are much more likely to use the government funded facilities. And some of those might give the impression that, oh, this is so much within this minority. But there are certain times wherein at times it's not as it's not there are times when it's true, but there are certain times wherein it's not the really true data that represent all the people in their respective communities. So, notifiable disease scheme. This is the flow. We say the doctors, the clinic, and the hospital, whatever they detect, either birth rate, death rate, or disease, they send it to the local health department. Please make sure that you understand this chart, because this scheme, because it's very, very important. Now, from the local health department, monthly summaries and annual reports are prepared. The data is sent to the state. Now, the state health department, whenever, especially when you're dealing with labs, with diseases, they have more resources. They have labs. They can do labs on some of those diseases to really know what are those, what's the cause of those diseases. So once they find out that information, they can also send that information to the local health department and then share it with the doctors, the clinics, and the hospitals. If you see the flow, the arrows, And they also help to develop health education, information, educates the population about the causes of this disease, how it can be prevented, and what are the possible cures, and what people need to do to prevent themselves from contracting that disease or infection. The case is investigation. They do the investigation. So the state health department does three functions. They provide support for lab to find out what the disease is. They also provide material, health education material. Knowing the information, they develop appropriate educational material. And also they do the investigation. So that data is sent to the Center of Disease Control and Prevention, the CDC. Now, the CDC does the investigation because, again, there you have professionals whose main responsibility is to investigate diseases. So once the lab from the state presents certain data, that data or that information is sent to CDC. CDC continues with the investigation. Now, the laboratory at CDC is much more sensitive, and there are more eyes looking at the lab results, and they can confirm because they have special reagents to help them identify some of these diseases. And they, as I said, they have expertise whose main function is to investigate these diseases. Then whatever the information they get, they send it back to the State Department, provide a weekly report, send that information back to the State Department so that the State Department can help develop ways to address that issue within the state or within the local department. So the information is also then sent back to the local health department. It's a two-way. Issue starts with the doctors, the clinic, the hospital. They go to the local health department. Now, the local health department, because of inadequate resources or expertise, send that information to the state health department. The state health department have laboratory and support. You have technicians, lab technicians who are good at investigating some of those diseases. And they develop health educational material and continue to investigate the case. Then that information is sent to CDC. CDC continues to do the investigation and confirm the laboratory. They do the laboratory confirmation because they have specific reagent and also have high volume of expertise who really are professionals in investigating diseases. So once they've done with their findings, they send it back to the State Department to inform they develop educational materials or whatever support that the local department might need to be able to address some of these issues, and send it back to the local department. So it's a two-way. Most of the time, CDC sends a summary report to state health department. Most of the time, some of this data is sent to some of the data that is sent to the state is not only information that really pertains to the states. At times, it's almost all other states, but there is a real focus on that particular state to know what is going on there. What are some of the issues that they should be concerned with that affect health? And the state provides a monthly summary to local departments or annual reports. And based on those reports, they use that data to plan. Because the intent is always to plan how can we continue to maintain a quality of health for the communities, for the populations that we serve. Standardized measurement of health status of populations. Mortality statistics. Now here, you're talking about mortality deals with death. How many people die in respective states or communities? So most reliable measurement of population health status is the mortality statistics, because there is no two-way. People are either alive or they are dead. And when it comes to those sort of situations, again, there are no two ways. Therefore, the mortality statistics is the most reliable measure of population health status. Life expectancy is the average number of years a person from specific cohort is projected to live from a given point in time. See, right now, there is the idea of, because of the onset of vaccinations, better treatment, better medications, better safety precautions that have been placed, more policies, good laws to prevent premature death. So as we go along here, you can see the life expectancy. This next table. From 1900, both sexes, life expectancy was 47.3% for both sexes. For male, it was 46.3. For female, it was 48.3. So you see, in 1950, it was life expectancy improved. People live longer. 62.2 was the average life expectancy for both sexes. For male, it was 65.6. For female, it was 71.1. So you can see how there are more advances in investigating diseases, knowing the root cause of certain diseases or certain conditions. As we advance with technology, we advance in research, we advance with therapy, people live longer, improved conditions, sanitation conditions improved, quality of food improved, infectious diseases, as you can see. In 1900, most of the death was mainly associated with infectious diseases. And with vaccination and proper diet and safety situations, those conditions have greatly improved. And with that, life expectancy has improved. Imagine from 1900 to 2013, somebody born in America is expected to live at least for 78.8 years. For men, they can live up to 76.4, and for women, they can live up to 81.2. See, again, these are all information that planners need to know. How long will people live so that we plan appropriately to address their needs? Because the longer people live, in some cases, if they are healthy, the more they can continue to produce, be part of the production machinery. With some, with age comes disabilities, and they have to be taken care of. So it people live longer, which is good because they contribute to produce. But in most cases, the longer they live also means people need to take care of them. So in most cases, as the number of birth rate increases, it helps to deal with the gap that might exist when people retire from the workforce. The next generation should be there to help take care of them. But in some countries, that has been a problem because the birth rate has gone down. People are living longer, and you have less people coming in to take their places. So most of the time, providing services for those people is very challenging and can be expensive. Years of potential life lost. Now, years, when you say years of potential life lost, usually deals with people who die. As we said, the life expectancy is now in the 70s. So when people die younger than 70, there is a potential loss of life. Years of potential life lost It's the number of years lost when death occurs before one life expectancy. You see, it's just, okay, if somebody was to live for 75 years and they die at 60, the, 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 the potential loss is 15. 75 minus 60 is 15 years. That person could have lived at least 15 more years. So just imagine for those kids who are born and die at infancy, or for those communities who continue to lose young people at alarming rates in some minority communities. There's a lot of life lost. Because when somebody dies, say in their 20s, in their this, when they could have lived up to their 70s, that's a big loss. It's a big loss for their family. It's a big loss for their community. And it's a big loss for the nation. And yes, you can even go further. It's a big loss for the world. Because every life has potentials. You don't know what that one life, one individual, what contribution they can bring into the world. So therefore, it's extremely important that we do all that we can to support life. Now, to do the calculation as, again, potential life loss, you subtract person's age at death from his or her life expectancy. And especially when it comes to minority populations, some of those statistics are really very alarming because we lose our young people at a much more higher rate than whites. And something needs to be done to address this big loss. Now, difficult to determine because life expectancy changes at different ages. Well, most of this, some of the data is a projection. It helps to help scientists, helps people who are dealing with population, studying population growth. Because when people know all this, they can plan what are the certain things that the way need. Because if people are going to live longer, we have to prepare for their own specific needs. Age 75 is often used in calculations. Okay, with death of young person as counting more than death of old person. Again, when a young person dies, it weighs more because the world is ahead of them. There's so much possibility that they can, to improve their own health, to improve their own communities, a lot of contributions that they can give to society. Old person's death, they have already giving most of what they can. So, in terms of their contribution, yes, nobody wants to die. But when you factor the contribution and the cost to keep them alive, most of the time, yeah, it's when you talk of statistics here, we're not talking about families, because some families will not want to see grandpa die even at 95. But everything being normal, the burden, the loss is much more pronounced when a young person dies. Now, other measures, disability. Some people become disabled, cannot produce as much as they could. So these are all things that when we really continue to look at some of these things, some people are disabled. And when people are disabled, most of the time, as they know, their level of production is compromised and their level of care increases. And at times also, you measure the burden of disease. One daily, one lost year of healthy life. Health, adjusted life expectancy, number of years of healthy life expected on average in a given population or region in the world. Now, sources of secondary data, because first we said, okay, some of this data we were getting them from the hospital, the clinics, and from doctors. Those are the primary data. Now, there are sources of secondary data that you can get some of the same information. The secondary data collected by someone else, possibly for another purpose. Because every now and then you have people counting different populations for different things to use for commercial reasons, political reasons, religious reasons, you name it. Useful in planning for public health programs and facilities. Some of these secondary data can also help in planning for public health programs and facilities. The programs, how big is the facility to accommodate the needs of the population that they serve? Then you have the US Census, always deals with population, how many people are in respective local communities, states, and the country. Now, the census usually counts the population every 10 years. Now, the data is gathered on race, age, the income of people, employment, level of education, dwelling type. Where do they live? What sort of accommodations do they have? What sort of houses? Are they homeless? You see, because all of this data is so important for planners to be able to plan appropriately using the appropriate number to be able to address the needs of their respective communities. Sources of secondary data. You have the vital statistics report. Vital statistics. Very, very important. The vital statistics are summaries of records of major life events. That's why it's called vital. Major life events. The birth of a child, the death of somebody, the marriage, people getting married, and divorce. The birth, somebody is added into the population. Death, somebody leaves the population. Marriage, somebody forms a union with another person. And usually as you go along with study, depending on whatever, the quality of people that are married in most cases is much better than somebody who is single, and is worse quality of life for divorced people, especially depending on the nature of the divorce. Are children involved in the divorce? Because the primary the primary individuals can go get married or whatnot, but usually it's not as easy as it is. So therefore, if people really are really interested in maintaining good health, it's better for them to work at their relationship, stay married when possible. Because divorce, yeah, is the other alternative, but most of the time it's not a very good indicator of good health. And this information is published by the National Center of Health Statistics under CDC. Also calculate death rate by race and age. And everything being normal because of some of the determinants of health, the social determinants of health, you will find out that the death rate of minorities, Blacks, Hispanics, and other minorities is much higher than those of whites. And even at the age, minorities die at much younger age as compared to their cohorts, white. Sources of secondary data. Morbidity and Mortality Weekly Report, prepared by CDC from State Health Department report. See, based on the information, as we go back to how the communication of diseases within their respective localities, the doctor, the clinic, and the hospital sends their information to the state sends the information to CDC, which is housed in Atlanta. And the CDC compiles all that information from the various states and send it back to the states, then to the local communities. And in most cases, depending on the situation, they will also support it with resources to address some of the challenges that are faced by either the state or the local health departments. Because CDC has more resources than the states and the local communities. And yes, there are certain states that have more health-related issues than other states. So most of the time, the CDC will provide support on need base. A report about mortality, mobility and mortality data by states and regions. A report outbreaks of disease, environmental hazards, unusual cases, or other public health problems. So the morbidity and mortality weekly report is very, very important. The MMWR. You see, if you are curious, you can just say mmwr.gov. Now you can go straight to CDC to get some of this. You see, you go to the mmwr.cdc.gov. You should be able to get this data to see the number of death, the number of births, the number of morbidity, or this on a weekly basis around your neighborhood. And you can do that for curiosity, the number of people dying from COVID within your local community or your state and the nation at large. So it's one of those data collection. And we collect this data mainly to help us plan, to address future issues or future challenges. Because everything being normal, we want to have zero of any or no disease and no morbidity, no sickness, because certain things that we cannot avoid or it's hard to control is the birth rate and mortality. That we can prolong life, but eventually life will dissipate and just death will be the next outcome. So the National Health Survey Act of 1956 authorized continuing survey of amount, distribution, and effect of illness and disability in the US. So this is a continuous from 1956. these things helps. Three types of surveys that they use is they interview people, and part of interviewing people, part of this is also the qualitative survey. Then you have clinical test, measurement, and physical examination. Again, these are the you do lab, you do measurement, and you do the physical examinations to determine the health of individuals. Surveys of places where people receive medical care. In some places, depending on where people live, can determine the type of quality of medical care they have, or do they have insurance. Those who live in rural areas are losing hospitals because people don't have enough resources to keep the hospital going. And who are the people who suffer? Are those people living in those communities. So when it comes to community health, public health, a lot has been done, but still there are still some challenges. Because you go to any urban city, you have far more doctors, clinics, hospitals within those communities. And you go to the south and to rural areas, you hardly have a hospital. Some hospitals have been closed within the last 10 years. Some have been closed even within the last 5 years within some of those rural areas. So now it becomes much more difficult for them to seek health care. They have to travel miles to the nearest hospital. So some people do not have means of transportation, and all those other barriers dealing with race and other issues. There you see the health disparities, the health inequalities. You have some national health survey. You have the national health interview survey. Now, most of the time, these are questions respondents about their health. Then you have the National Health and Nutrition Examination Survey, the NHANES. They assess health and nutrition status through mobile examination centers. CVSU has the agriculture, they have a mobile unit that visit different places just to find out some information that pertains people's overall health based on their nutritional status, based on the amount of nutrition that they have. And as with some of those challenges, see, there are certain things you can almost predict. You go to minority areas, you have nutrition desert, deprived, they are starved, don't have the appropriate type of nutrition. You go to some wealthy urban areas, you have a lot of opportunities for nutrition, for healthy nutritional services. So people's socioeconomic status where they live, and in some cases, their race, unfortunately, determines the type of food that is available to them and the amount, because some, especially when it comes to kids, some kids don't have the appropriate nutritional requirement for them to grow in a healthy way, help them to develop those brain muscles so that they can learn appropriately. That's why you have some of this food being served to kids by different communities, by the school systems, so that the kids, when a kid is properly fed, the kid has the ability to learn. You see, because most of these things that you see there, we talk about, oh, even some kids, especially minority kids, don't believe that they are smart, which is not true. Minority kids are just as smart as white kids if they are afforded equal amount of treatment, equal amount of resources, and equal amount of respect. And set equal amount of expectations for all, not looking at their race, their socioeconomic status, but look at them as individuals who have the ability to learn, who have the ability to be productive, and who have the ability to make a difference if given the appropriate conditions. Then you have the epidemiological studies, investigation carried out when disease or death occurs in unexpected or unacceptable number. See, right now, again, there's a lot of epidemiological studies that are going on because of this COVID, just to deal with some of the amount of people that we lose on a daily basis. Then you have the descriptive studies, describe epidemics with respect to person, place, and time. Then you have the analytic studies aimed at testing hypotheses. You have the descriptive studies, as the name describes, and as the name suggests, descriptive. It describes epidemics with respect to people. Who are the people that are faced with this disease? Place. What is their locality? Where do they live? The environmental factors. Do they live in healthy places? Proper air? Or do they live in polluted areas? Polluted water? Or they live in places close to convenience stores? Because now studies have shown kids who live close to convenience stores are much more likely to be obese, because most of the things sold in those convenience stores are just fatty foods that do not promote good health. And also time. Okay, then with descriptive is who, You count the case, followed by who is ill, say children, men, women, and what race. You go when, the time of onset of each case, the epidemic curves created, and where, determine residential address and travel history. You see, because even right now, when they are asking for COVID, they'll ask you, did you travel out of this country? Or did you travel out of the state? Those are all sorts of descriptive data that they're looking for. Okay, then you have the epidemic curve, a graphic display of the cases of disease according to the time or date or onset. You have simple epidemic curve, can be used to calculate the incubation period, how long the disease takes into the human body before it starts showing symptoms. That's why with the COVID, whenever you have been exposed to somebody with it, for fear that you might have been exposed to it, most of the time they say 10 days, 14 days, so that you stay away from, you self-isolate, isolate, so that if you were infected, that period, the incubation period, is enough to show by the end of the 10 days or 14 days, you will exhibit the symptoms. But if you were not 10 days, you fine. You were not exposed to the virus. So period of time between exposure to an infectious agent and the onset of symptoms. And that's what just. So common source epidemic curve, point curve epidemic, continuous curve epidemic, and propagated epidemic curve. You have the analytical studies, they test hypothesis and relationship between the issue. So most of it is your observation, they investigate natural resources, and at times they use also the experimental studies. Now, carried out to identify cause of disease or determine effectiveness of vaccine, drug, or procedure. Most of the time, when they are testing the effectiveness of vaccines, they develop, you have the vaccine and you have a placebo. They look almost the same, but one is just a placebo. It does not have the medicine in it. So they give one set of people with the real vaccine and the other set with a placebo, and expose those two groups to the infection. Those with the placebo, if those with the placebo show any symptoms, then that's taken into consideration. And those without the placebo, if they did not show any symptoms, instead they show antibodies to fight against the infection, it means the vaccine is effective. The efficacy of the vaccine is good. So now we hear a lot of, those first stages when people were developing the vaccines, they were dealing with two sets. Some people, they gave them the vaccine so that they would develop antibodies to fight against the virus, and others, they gave just basic placebo. Could be that distilled water or something else, or just basic saline, which does nothing to fight against the disease. So when they are exposed to the virus, they do not have antibodies and they succumb to the disease. Those that received the vaccine, their body develops antibodies. Those are bodies that will fight against the virus. So when they are exposed to it, those antibodies will keep the virus away. Antivirus, they fight to not allow that person to be infected. Or if they are infected, they might experience some slight symptoms that is not enough to keep them sick or take them to the hospital. Unlike the ones that receive the placebo, they can be sick and some can be taken to the hospital and some might die. And whatever, most of the time, what usually happens is no sooner they realize that, okay, the vaccine works, they will call all those people that were given the placebo and give them the real vaccination so that they are also they are also given the chance to develop antibodies to fight against the virus. Questions: exposure causing development of disease. You have criteria: the strength, the consistency, specificity, temporality, and biological pulsability. So these are discussion questions. How can data collection for notification of disease be improved? What is tracking vital statistics so why is tracking vital statistics so important? How does calculating years of potential life lost change the way we think about community health efforts? Again, if we see so many people losing their life, they're losing potential life lost, I think we have to find ways to make sure that we reduce that number. First of all, why are they losing their life so early? What are some of the causes? And how can we prevent it? Okay, thank you. And make sure that you stay with your book, study, and please, if you have questions, get in touch